And some of the gaps that we recognized wasn't that we didn't have services. It was that there's a lot of people that didn't know about our services. So we have a huge community gap of knowledge surrounding the services that we do have. And because we don't, and I don't want to say invest, because we don't know about our services, a lot of the times the money goes away and those services go away without even having the opportunity to get up and running. So one of the big things with FFPSA was we really wanted to take a look at the services that we did have and support those services, support our community agencies, and support our community members. And so that communication that we had together really made this process a lot easier than it could have been for our rural community. So going back into that, when we sat down to discuss FFPSA, we really looked at what services, what meetings, what everything we already had. Many of you who live in a rural community, you know, you wear 15 different hats a day. And so the idea of adding yet one more meeting or one more team was very daunting to us. So we decided, let's use our 2083 to support these initiatives in this plan, because we're already meeting. We already have public health, behavioral health, far northern. We have all these partners coming together to talk about students and our youth anyways. So why not use that? Let's leverage our pre-existing interagency meeting to have the conversation and to support our services that we already have. So as you can tell, Lassen County Probation is the lead. And then everything filters down to the agencies, and then it comes through our children's system of care. And that's how we reach out to our community partners to make sure that all of our students and youth are receiving the services that they need. So Chief Branning, as the lead, and working under her for many, many years, I can safely say that I know this about her. She does not want to create a program and then push it out for staff to not have the buy-in, to not know what it is. So she gave it to us. She said, I want you guys to work through this. I want you to create the plan, and I want you to make sure that it's feasible for our community. And she really gave us the authority to have those conversations and to work through what would work and what wouldn't work for our community, to look at our learned experience, to look at our experience, to look at the experience of our community, to figure out what was actually going to work. She really emphasized sustainability, and what's more sustainable than having staff that are going to be running the program write the plan. So we all sat down as line staff and we worked together to figure out what would work for our community. Some of the cons to this was not really having an extensive knowledge of everybody's funding capabilities. As a supervisor, as somebody at LCOE, as anybody sitting at this table, we don't know the intricate details of funding. And so working through that was probably one of the biggest cons throughout the entire process. And we're still working through that right now.
And I think just to add to additionally on the cons, with probation being the lead agency, the bullet point delegation of workflow, that becomes somewhat of a challenge at times because there's delegation coming from the probation department to maybe Crystal, who is one of the leads, with Kim on the implementation team. So that does pose some challenges as well, but we are navigating through that. And Megan mentioned it earlier, our county, even though we're unique in a lot of ways, I think our communication is one of our strengths for all of our agencies. So that is a great asset and tool that we use as the communication to make sure that that delegation of workflow doesn't get misinterpreted in some way coming from a lead agency to another agency.
And going off of that communication, we're all working towards the same thing, and we are all working towards the same thing in silos. So public health is working on Lassen Links, which is in a referral agency where they refer out to services. LCOE is working on removing barriers. Probation is working on, we're all working towards the same thing, but we weren't having the conversations. So FFPSA really forced us to sit in a room and have those conversations of, okay, what's public health doing? What's child welfare doing? What's probation doing? What's LCOE doing that we can bring to the table and work on together and break funding?
So our target population is a little bit different than most, and that's just based on the data that we gathered through our safe measures. After reviewing multiple data sources, it was determined that we were going to pick the population of child welfare referrals that had been evaluated out. And emphasize on ones that had also had prior referrals in the past 12 months. And we determined that to be our focus because currently our child welfare department was evaluating out with no referral to other community services. And we thought that FFPSA would be the perfect opportunity to allocate resources and funds to evaluate out maybe ones that didn't meet criteria, but connecting them to those community supports. And then that kind of aligns in those three goals that we set, that we have. The first is that early detection and connection to prevention services for youth and their families that experience maltreatment or at risk of foster care. And we do this because we know that screened out families are potentially missed opportunities to prevent future maltreatment. And the state data indicates that screened out families are at a higher risk of re-referral. And there's a lot of research that supports that providing community-based services earlier on can reduce future CWS involvement. And we're doing that by building community capacity to expand prevention services and access points through braided funding. And as Megan and Sarah had mentioned, us wearing multiple hats and being a small community, we have really worked hard and been intentional in our cross-sector collaboration and really breaking down those silos and looking at it more at a broader of this is our community, these are our children, no matter what door, no matter who they're interacting with, we're all here to support and help them. And that goes along with that system change that the state and the federal vision is wants us to go towards approach to prevention, right? And here in Lassen, we do the Lassen Links, like Megan mentioned. We are having some home visiting, wraparound, foster youth services, LCOE, mental health initiatives are just some of the ways that we're working to build community capacity. And also, I am really hopeful our child welfare department and other partners are wanting to shift away from that mandated reporter to more of a community supporter role. And I was reading some information from Safe and Sound, and they were emphasizing how great utilizing the Family First Prevention Services Act is and shifting that focus to be more community-based service providers and early intervention. And then 3, provide oversight and monitoring of the safety of children that will receive services through data sharing and collaboration. And that really factors into that children's systems of care that Megan was talking about. And we are using our governance structure to maintain and hold us accountable to those outcomes and to these goals that we have set. And that will look like quarterly reporting through system of care on number of evaluated out versus people receiving referrals. It will also look like us really taking a deep dive and like a harder look on what it looks like through that referral process. If we're getting that good, meaningful engagement, if we're not, exploring barriers as of to what that looks like. Could it be because Lassen County is really spread out? Are we not reaching our outlying populations, and how can we better do that? Are we not getting good referrals from other agencies? There's just a lot of ways that we're looking at making sure that our system of care is participating in that quality improvement, that quality assurance and improvement. And then this is just, it looks like it's really confusing and a whole bunch of arrows everywhere. But as we know, the nature of the system sometimes it is confusing, right? But what I want everybody to really focus in on is that everybody now is hopefully funneling through one source, as we've mentioned, breaking down those silos and those barriers, right? So our hope is that, you know, all of these referrals will then be caught with this one screener. The screener will then determine what it looks like and what services our youth and families require. The tier 1 over there in Lassen links are the ones that don't maybe need super intensive case planning services, but just need to be connected to something in our community. We'd be utilizing the Lassen links. Tier 2, like it says right there, FFPSA candidate, right? So there you're going to require a little more extensive case management services. And currently, our tier 2 evidence-based intervention that we've proposed to use is our wraparound program here with MI. And we did that because we know in small rural communities, bringing in evidence-based programs and then not maybe having the guaranteed sustainable funding makes it really, really difficult and everybody really shy as of to want to come in. So we said, what do we have here in Lassen that has good outcomes that we can reach our population and make a meaningful change? And so that's why wraparound was selected. And then obviously, right, the system of care, those are going to be our outliers that are kind of wobblers to let them determine, do we want to try do FFPSA candidates, Lassen links, or what does it look like for tier 3? Our tier 3 right there is our formal entering into care. They are looking at utilizing FM or family maintenance, also kind of going back and all getting referrals to our wraparound program as well.
Okay, so on the next slide, we have metrics. We need to identify the needs, educate the community like we talked about, and support families. We spoke about our target population being the evaluated out cases from CWS, and some of the gaps and barriers that we've identified to getting in touch with these people: transportation, long wait lists, lack of community member knowledge of the services that are available, and inpatient programs. Our current service array meets the needs of some of the youth and families in Lassen, but there's also many needs that are not being met due to these multiple barriers and accessing services. Along with the barriers mentioned above, there are some other factors which include stigma, fear of child welfare and probation, and perception of a lack of confidentiality due to Lassen being a small community. Since our target population is evaluated out neglect referrals, Lassen County Child Welfare has committed to sending out a contact letter to those families offering services. That's just one more way we can get in contact with those folks and let them know what's out there. If there is no contact, there would be a follow-up by the FFPSA screener, because we know that authentic engagement of the family is necessary for them to feel comfortable participating in services. The main adjustment to our current services is expanding our Lassen County wraparound program. In a small county, bringing in new evidence-based programs is difficult. To ensure sustainability, the planning team decided to utilize what was already here and functioning well. Our local wraparound has a proven track record of positive outcomes and mitigating out-of-home placements. Lassen County wraparound has already been serving a small number of our target population through their prevention caseload. To accommodate the increased caseload, they hired additional staff, and all facilitators are certified in child and adolescent needs and strengths, CANS. Also, to ensure high fidelity wraparound and accountability are achievable, the program has made the necessary changes and implemented practices to receive certification through CDSS. Our goal is obviously the increased safety,
I stayed longer than I thought I would.
and well-being for our community.
And on just as a wraparound facilitator supervisor, to piggyback a little bit off of Kim and talking about a proven track record, currently right now, actually more than 50% of the population that we are serving right now on our caseload are prevention already. We have more prevention cases that we're serving than actual children in care.
And that brings us to spending and sustainability. The local system partners are committed to sharing resources like we've been talking about to provide early intervention through a coordinated effort to maximize potential reimbursement. The funding streams are currently being built upon to support prevention, and active efforts are in place to explore the feasibility of braided funding to draw down funds outside of the FFPSA state and federal grant funding. To maximize sustainability, the planning team has been intentional in our efforts to leverage current services that are already functioning and supporting our community, like Megan was talking about. It is the intent to continue to be diligent and appraised of other potential new funding opportunities as they come up. All the system partners are committed to using funds strategically, not only to meet the short-term goals or fill in the gaps, but to move the children's system of care to a truly more preventative system that focuses on strengthening families and communities.
And just, you know, it may seem kind of funny for it to say fiscal to be determined, but that really is kind of going back to what Sarah, I think, had talked about that staff turnover and that in small rural communities, right? Is that at this point in time, when we get into our planning efforts, when we have people leave positions that may be familiar with funding streams and how to draw down on them or how to braid them, when they leave or exit, there's there's loss of knowledge, right? And so right now we're kind of in Lassen County and that like knowledge acquisition phase of really bringing our fiscal team up to speed and figuring out what it looks like for all of us to align our funding so that it can be sustainable.
And a mechanism as well for the other agencies that are on that planning team and the implementation team to be able to draw down funds for reimbursement for their time as well. Probation time studies and has time studied for quite some time, but that mechanism, when you don't have the fiscal knowledge base from community social services, makes it a challenge for that information to get out to the team.
Thank you. That's the end of ours.
Thank you, everyone. That was great. And just so my understanding is Lassen is the only county in the state, actually being a probation lead agency is the only department and the only county that is a probation lead agency. So congratulations to you all. And it seems like you guys have done a lot of work and it's looking great. And I know that the fiscal piece, that braided funding piece can be a bit of a challenge for everybody. So thank you for that. That was great. So now we're going to go ahead and turn it over to another Megan, to Megan Gotcher over at Humboldt County to hear about their plan and how they're doing things. And just a reminder, if you all can please mute your microphones, and that'd be great. Thank you. Okay, Megan, it's all yours.
know, I don't know if Sarah was messed up, but Lassen County has a Megan and a Sarah, so every time they said Megan or Sarah, I would pop up like, what?
I was just, it took me like about 3 minutes and then I was like, that's right, we had this conversation last week, yep.
Yes. So at the bottom of your screen, you have the reactions button. And if you are a parent, I would like you to give a thumbs up in that reactions tab there. And if you are a parent of a tween or a teen, then put the heart, because we need reminders if you are a parent of a tween or teen, because you're embarrassing, you don't know anything, you don't listen. And if you haven't gotten there yet, buckle up, because you will, for sure. So this presentation is for you all. Parent Project is a guidebook for parents of tweens and teens, and Candace will share more about that with her part of the presentation. In Humboldt County, we are very large. We have 4,000 something miles, 136,000 population, and we have 8 federally recognized tribes and rancherias, 2 of which, the Karuk tribe and the Yurok tribe, both also have their own comprehensive prevention plan that was approved. So because we have so many areas that are rural, it can take 6 hours to get from one end of the county to the other end of the county, and probably multiple hours on either end, depending on where you're actually coming from. Probation received $78,496 for the FFPSA grant, and child welfare received $555,000. And Cindy will explain some about how those funds were used for child welfare services and how they coordinate and collaborated together. Parent Project is a promising practice. It is a recommended EBP to be reviewed by the Title IV Clearinghouse. And very recently, the Board of State and Community Corrections is offering STC credits for probation officers that get trained in Parent Project facilitation. Next slide. So this is kind of how we're going to run this PowerPoint for you all, and we're all going to share a little bit of our expertise in specific areas.
Hi, so I'm Cindy Sutcliffe. I work with the Department of Health and Human Services. I'm physically placed in child welfare services. I was a former program manager in child welfare services. Then I retired, and then I came back to work for the county to help implement Family First Prevention Services Act. Not only get the plan written, but also do all of the implementation.
And Megan Gocher, I'm the Juvenile Division Director at Probation. I've worked for the department for 23 years and also started as a JCO. So I heard that from Lassen County as well. Some people started there. Cindy kind of minimizes her role in this. She is the whole reason that this plan came to be. She pulled us all together for meetings and really got us all collaborating to figure out what was going to work for Humboldt County. Candace?
Hi, my name is Candace, and I have been with Humboldt County Probation Department for about 16 years. 14 years of that, I worked with adults, been with the juveniles for 2 years. And before that, I was a teacher and worked with alternative education schools. And I've been a foster parent for approximately 12 years, had lots of kids in and out of my home, and also worked with Healthy Moms program. So I come with a lot of experience with parenting and working with youth, but I learned something every time I was in this class.
Hi, everyone. I'm Sarah. I've been with Humboldt County Probation for a little over a year now. I'm a recent graduate from Seattle University. And so I've been kind of thrown into all this FFPSA, planning and data, whatever you call it. My brain is elsewhere. But like the data collection and things like that. And it's been a really great experience so far and getting to learn from all of these wonderful people who have several years of experience. So I'm really excited to get to share some of the data with you guys today.
So Family First Prevention Services Act is really hallmark federal legislation that acknowledged that our national foster care system does more harm than good. And the legislation moves funding from foster care to prevention. This change in focus from reactive to proactive is permanent and could over time reduce the number of children and youth in the foster care system by about 50%. It provides a mechanism for community-based organizations and tribes to access federal foster care dollars, otherwise known as Title IV, to provide secondary prevention services, evidence-based practices, early on or upstream. The 2 bullet points on this slide are critical to the success of our comprehensive prevention plan, because through our community pathway sites, we are going to increase the ease of access to primary and secondary prevention services using technology. As Megan said earlier, our county is geographically large with a very small population, and getting from one part of the county to the other is often very challenging, not just simply by distance, but due to weather and the cost, both time and gas. In Humboldt County, Probation and Child Welfare Services partnered at the opt-in point to receive the state block grant funds that Megan mentioned earlier. Next slide, please. So to find out what primary and secondary prevention services the families of Humboldt might need, we conducted focus groups at our community pathway sites during the late spring and early summer of 2022. And we asked the focus groups to identify the services available at the site where they were meeting and to determine if those services were easy to access or if there were barriers. And if there were barriers, what the barriers might be. We asked them to identify new services that the site needs. We asked them to identify things that the site could do to improve both the engagement of families and also for accessing services, and then also to create a marketing plan for the site. Next slide. So our 20 community pathway sites are scattered all over the county, and that's a good thing. We have 16 family resource centers. We have the Bear River Band of Ronerville Rancheria, Trinidad Rancheria, and the Wiyot Tribe Social Services Department. And we also have the Humboldt County Transition Age Youth Collaborative, which is otherwise referred to as HCTC. We conducted 19 focus groups that were held at the community pathway sites, and we had 160 individuals with lived experience in either child welfare services, foster care, or probation, and identified among the items that I mentioned earlier, the categories of secondary prevention, which are evidence-based practices that they felt were needed. And these included parenting education, in-home nursing, and substance use recovery. 3 of the focus groups were conducted in Spanish and 3 were tribal specific. And all of the focus groups identified that they did not want to travel any farther for the service than the site where they were at that point in time, and that they would be more than willing to participate in that service using technology if it was available. So with those components, the types of service, the desire to travel only as far as the community pathway site, and the willingness to engage in the service using technology, we put a few things in place almost immediately. If the site didn't have it or something like it, we had them get a free Zoom account so that they could schedule program assessments virtually. And then we went and asked the Child Abuse Prevention Council, CAPC, to allocate the annual Children's Trust Fund dollars to the 20 sites so they could then upgrade their Zoom to a commercial version that would allow them more flexibility. We reached out to the providers of the identified evidence-based practices and began the conversation of providing virtual assessments and virtual service provision. So once we had assurance that they could or would provide their program remotely, we then featured them at our monthly community pathway site meetings to educate the sites about the variety of secondary prevention services that were available using technology. Because of the vast geography of our county, using technology to access primary and secondary prevention services is a key element in moving our comprehensive prevention plan forward. Next slide.
Sorry, I got my slides on the wrong side there. So Cindy talked about using those funds to support the FRCs in getting their Zoom license and as well as Wi-Fi. So all the FRCs have Wi-Fi, which allowed them.
Grandparents, I have down that you'll continue to follow.
Thank you, which allowed them to provide additional services in their communities. So we have partnered, Candace will talk about this, but she has partnered with a local middle school here in Eureka and with the local police department as well to provide Parent Project to teach that as a collaboration as well. And so we felt like Parent Project was such a good way to reach these parents. And we sit on the SARB board, the Student Attendance Review Board, that was a good connection as well to make referrals to parents to Parent Project. So the FRCs were requesting, hey, Parent Project sounds like a great program. We'd really like to bring it out to our areas. And so we tried to figure out how we could do that. Well, using the Wi-Fi that Child Welfare Services provided and the Zoom accounts. And we know how much Zoom has made meetings and things very easy to use. We can meet with people anywhere now. We can include other people in child and family team meetings and things like that, that we couldn't do that before. So we know how well we can use Zoom to reach out to those more rural areas. So we sponsored the FRC staff through a training of Parent Project, and they are going to be able to continue teaching Parent Project in their communities, and they can use their ACEs, the Adverse Childhood Experience grants, to keep that going. Next one. So how we started this was we invited 7 of our rural family resource centers to attend a meeting to talk about Parent Project, to gauge their interest, share a little bit about what the program was, and to see if they would be interested in this pilot hybrid program of Parent Project. We had 6 of the FRCs send staff to our initial meeting discussion. And from that meeting, we had 4 staff from the FRCs that were trained at 2 different FRC sites. And we reached out to the more rural areas, and we did receive staff that committed to providing it at 2 of those FRCs. Some of the preventions that provide some of the barriers for some of those other FRCs from either attending, the training, it's a 2-week training. So it was pretty intensive time-wise, as they were the only staff member on site. They didn't feel like they could dedicate that much time to the training, or it was during the time they gave out meals or things, so that they had some barriers to attending, unfortunately. So we didn't get as many as we would have liked, but we did get a commitment from some, as well as they provided that they could keep this going by using that ACES grant. So we sponsored the staff members going through the Parent Project facilitation training, and we provide at our own Parent Project, we provide childcare and meals, because the class is from 6 to 8 p.m. 1 night a week for 10 weeks. And that allows parents to come and not worry about food for themselves or their children, not worry about childcare, because the childcare is offered there on site. And then we provide the books for them as well. There's a book for each parent that attends the Parent Project. So we bought those books for the site Family Resource Center sites, and we gave them a stipend so that they could use that in whatever way that they felt like was most impactful for their areas. So one of the Family Resource Centers said they really felt like gas or transportation was going to be a barrier to their parents participating in the program, or tutoring, because they had maybe this older, this tween or teenage, that tutoring might be more beneficial for their kids rather than like childcare. And our first hybrid session is actually tomorrow night. So we're very excited to see how this goes. So Candace will be presenting via Zoom. She will be there in person with her own class at the middle school with one of the teachers on site there. And then she will Zoom through the other 2 family resource centers, because even though they've gone through the training, they can go off and do it on their own. This will provide them the opportunity to learn from her as she's facilitating, as well as facilitate in their small groups. So she will be in front of the room facilitating the class, and during the breakout sessions when parents work in their smaller groups, they will go into like a breakout room, but we'll just mute and everybody will kind of work with their own facilitator on site there. That way the parents can still build that collaborative relationship amongst themselves at their more located area for them. So you can wish us all well for tomorrow night.
I just want to start with, this really does bring communities together. And in our instance, it's bringing all the county, outerlying areas together with the other communities. And we have the police department, the schools, and probation, all working collaboratively. So that makes it a really, really cool program and really helps us to tap into all of our families. But there's some facts up there, and I just wrote little blurbs. I'm going to read that and you can follow along. Parent Project is a parent support program designed to help parents identify, prevent, reduce, or stop behaviors that can threaten a child's safety or prevent them from achieving their goals. The program's been working with families for over 35 years, and in that time, they've worked with over 1.5 million parents who are struggling with their children. Communities using the program have reported significant reductions in the number of calls received by law enforcement for support, improved communication between parents and youth, and an overall increase in the confidence in parents' ability to parent their children. The Parent Project uses methods proven to work. It was developed by a team of individuals that included law enforcement, educators, and social workers, as well as families. It's built on the knowledge that while we cannot control our children, we can control many of the things that they enjoy. An example of one of the more popular tools used is a method called T-spots. I think we have another slide on that one. And what a T-spot is, it's where it stands for take everything away for a short period of time. This differs from traditional parenting techniques like restricting youth for longer periods of time, no phone for a week, because that often results in arguments, frustration, and feelings of hopelessness or overwhelm. Parents and teens report this new method returns harmony to the home quicker, and there are fewer outbursts and arguments. Another popular method is the use of a yes response whenever possible. All too often, teens shut down or become angry and resentful when parents respond negatively to their requests. An example of this use of a positive would be, can I go to the basketball game with my friends on Friday? Rather than responding, no, you didn't turn in your homework last week, blah, 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 and then there's a big debate. They would say, absolutely, yes, you can go to the game as long as you turn in all your homework this week. And then if it doesn't happen, the responsibility is placed back on the child. Just these mild little tweaks really have helped a lot of our families report that they've made big differences. So these tools place the responsibility back on the teen, and they're developed to address parental concerns about their teen's use of drugs, alcohol, peer groups, school attendance, grades, running away, or general defiance. They're practiced with every week. Towards the end of the sessions, they're breaking out and they have homework, and they're going to bring it back and discuss it with other parents. And that's what makes this special too, with reaching out to those rural areas. There might not be as many participating, so we can offer them support from where we are. As a parent who was formerly a participant of the Parent Project and as a facilitator who now presents the program to other parents, I can personally attest that the Parent Project works. And we are so happy to support rural communities in accessing this valuable resource.
Thank you, Candace. Okay. So I am going to talk about some of the preliminary data. This is based on the first set of responses from one of our most recent sessions that happened this past fall in 2023. And our hope moving forward is to capture this data at the beginning of each session so that we can track the communities we're serving and any gaps that still exist in service delivery. And so right off the bat, on average, care providers were 41 years of age and the youth were 11 years of age. Most respondents had 2 or more children in their household, and many were provided care during the classes that were offered. Most respondents owned their homes and were female. Gender was based on self-reported identities. And then the average income for a participant was less than $40,000 per year. And then when diving a little bit deeper, a little over half of the participants in the course were birth parents to the youth, and the remaining portion were adoptive, foster, or step parents. Most of the participants in the survey reported to be single parents, but about 20% have a partner or spouse in the same household. And then moving on, half of the participants who responded were white, followed by about 20% Hispanic, 20% of multiple races, and 20% of Native American or Native Alaskan heritage. Of the participants who responded, there was a wide variety of education level attained, all the way from high school diplomas or GEDs to advanced degrees. We found that in looking at all of the demographics and all of the household data for our participants, these responses really varied greatly. And we found this to demonstrate that Parent Project is sought after, not just by one group or one type of parent, but any parent from any background. As a lot of instructors for Parent Project like to say, kids don't come with a handbook. The hospital doesn't send you with a guide to tell you how to raise a kid. So feeling like you aren't cut out or are struggling to support your child is not an isolated feeling to one type of parent. And part of the survey that we use both at the beginning and the end, the protective factors survey, it asks for feedback from our participants that we can kind of gauge how is this program supporting them or helping them, and what successes are they feeling like they're achieving. And these are just some of the responses that were given. Feel free to just read them over. We found that with all of the participants who responded to the survey, there was some degree of confidence developed by the end of the course. And especially just this overall feeling of support and readiness to take on the challenge of raising a child and to better communicate with their kids. And we were all just really impacted by the relationship building among the parents within their classes, and just that collaboration that took place. And they were super appreciative of all of the skills that they learned. And so that kind of wraps things up for us. I'm going to leave this slide up for a little bit, and then I'm also going to put some of our contact information as well as the link for the Parent Project site in the chat. That way, if anyone has like follow-up questions or wants to learn more about Parent Project, you guys are welcome to email us, reach out. And yeah, I'll pass that back to Kathy for questions.
Candace,
Thank
there's a
you.
question in the chat. What is the targeted age group of the curriculum?
There is a curriculum for younger kids, but the Parent Project itself is geared at tweens to teens, so probably age 11 through high school.
And that's the target population that you all are serving, is that age range?
Our comprehensive prevention plan actually didn't identify a specific target population. We basically said every kid in the county that's at risk of either entering child welfare or the probation system would be our target population. So this is just one segment of the whole big plan that we are doing. It's incredibly successful. We loved the fact that with the outreach to the community pathway sites, the family resource centers, that we had so many takers that said, yes, we want to be able to do this. And as Candace said earlier, this is going out into the, well, I mean, we're a rural county, but even to the more rural areas of our little rural county to be able to help these parents successfully parent They're tweens, and it creates kind of a weird, but what we're hoping to be sustainable virtual support group that these families can stay connected over time too.
I would also like to add that although that's the target for Parent Project, most of the parents that we served in the class had younger children and all reported that the skill set that you learn through the class can be applied to any age. We also have so many community members that have volunteered to come in at different times to give small presentations. So further adding that sense of community.
And probably another sense of support as well. Kind of seeing people from their community. There is another question in the chat, and then I'll get to you, Jessica. I see your hand up. Wondering if it is evidence-based or evidence-informed.
It's a promising practice, and it is one of the evidence-based practices that is being looked at or recommended for review by the Title IV clearinghouse. So we're hoping that it's one that will be a well-supported in the clearinghouse, that it could be used then as part of the Title IV, but currently it's a promising practice.
We put quite a few EBPs that already existed in our county, such as Parent Project, into our comprehensive prevention plan. I think we have 12 evidence-based practices, but they're already being delivered by organizations. We weren't bringing anything we weren't trying to create anything brand new specifically. And we've been advocating on behalf of these EBPs to CDSS to have them included in the revision that supposedly they're going to be doing at some point in time, adding more of these EBPs to it. Because the year after we really got the traction going on FFPSA, the federal government moved from agreeing to fund well-supported to also moving to fund supported EBPs. So they're lowering the bar, which is good. And we're just hoping that the state in turn lowers their bar so that eventually these EBPs can draw down the Title IV funds, or at least 50%.
Yeah, let's hope. Jessica, did you have a question?
Yes, I just, I might have missed it, but so you're doing the hybrid model, but then are you also exploring providing the Parent Project during different times throughout the day, or is it mostly through between 8 and 5, or is there anything after hours as well? And then also, I know you had mentioned the outreach is done through FRCs, but is there other outreach being conducted, considering your county is so large?
Yeah, so it's so the outreach specifically to the family resource centers, because that's what we used our FFPSA through Cindy through child welfare to bring them the additional remote access, the Zoom and the Wi-Fi, and make that a hub, because the area is so large and the FRCs really wanted to be like that community hub. Parent Project is supposed to lead the parents to support one another even after the class. And so it's not offered at different times. It's offered currently, it's every Tuesday for 10 weeks from 6 to 8. And when we trained the FRCs, they can go on then and teach the next classes at a time that works for families in their communities. If there's a better time of day or day of the week, after hours, whatever. We have found that after hours works for people that work. So, and because you want to have a group of people, so you want to have a group, they work in groups of 4 when they're working on their small group projects. And so you need to have at least somewhat of a small group to have that.
And then to speak to expanding the referral process, all 20 of our community pathway sites, the 16 family resource centers, the 3 tribes, and HCTC are part of our county differential response team through child welfare services. And we basically, CWS sends a letter to the family through that gets reported, and they're not going to go ahead and doesn't rise to the level to do an investigation, and specifically identifies that FRC or tribe or HCTC as it pertains to wherever the person themselves is living. So it's a direct referral. And so we're anticipating, and we usually do get about 300 to 500 differential response referrals over the course of a year through child welfare services. So we anticipate that we'll be getting more through that. But then in addition to, we've got this whole state, the task force is moving on mandated reporting to community supporting. And one of the things that the state's been going on and on about is using your community pathway sites, or the ones that we have, as a way to shift your mandated reporters to actually making the referrals directly to those community pathway sites when it doesn't, involve actual child abuse as it's, defined under Cameron.
Actually makes sense to make a lot of streamlining of those referrals. Thank you. I have another quick question. I don't see any other questions or any other hands up right now. So it's in regards to the funding. I may have missed it, but you did mention that FRCs could leverage their ACEs grant. Was it training and the other, was that funded through the state block grant, or were there other funds that provided the funding to put on the initial trainings for Parent Project? Or how is that funded?
So I'm sorry. I'm gonna
Nope, go ahead.
answer the question with regards to the ACEs grants, because
Okay.
I know about. So Family Resource Centers receive through the state, there's a state Family Resource Center Association, but they get ACEs grants, adverse childhood grants, to be able to address adverse childhood experiences. And what was consistently said about the 6 sites that Megan and Candace have been working with was that they could use part of those dollars to leverage to cover the other 50% of delivering Parent Project, so that they could get the Title 4E drawdown for 50%, and then their ACEs grant would be the match. We're probably going to use state block grant funds, CWS state block grant funds, to get things going. Right now, probation is using their state block grant funds, but if that runs out before CARES comes up and is, running October 1st of 2026, we'll use some of our CWS state block grants to continue these programs as they're identified as being needed within the community. So did that answer that question about the funding piece? Okay.
Yes, thank you. And then I had a quick question for Lassen County in regards to your tier structure. You mentioned, or I saw the tier 3 included your probation referrals or your youth involved in probation department. Did that tier 2 involve any youth who may have been referred to probation, maybe is through the diversionary process, or any other of those kids that have been referred to probation at all?
Yes, so tier 2 would be diversionary, or doesn't reach the level of like formal intervention, but are at risk for, having to open up if they don't receive the supportive services. Yes.
Thank you.
Just an additional note for Lassen too, our probation department has been in the preventative work for several years. We operate a large truancy grant that we contract with almost every school in the county, except for the high school. So our officers and staff do a lot of prevention work in the schools with behavior related issues. And then even when we do have those referrals that come into the probation department, we have really looked at a different perspective and shifting that focus to very much a diversion type of opportunity for those youth that come into the probation side of the house.
And to speak further to that, because of the prevention services that were in place here at the probation department prior to my departure, when I moved over to Lassen County Office of Education, one of my main goals was to make one of our local service providers of youth programs free for every student, so that probation youth who were going through the intake process or diversion process, their parents did not have to pay for the services. So one of our local, community-based organizations, every student in Lassen County can have free services through that program through the MHSSA grant.
Oh, nice. That's great. Thank you for that. Let's see. So there's another question in the chat. From Anna Victoria Salcido. I just browsed the site and there seems to be a heavy Christian undertone throughout the program. How do you support families, make them feel like this program is for them if they aren't Christian? Apologies if I missed this. I had to step away for a portion of the presentation. And Anna, I'm guessing that's geared towards the parent project at Humboldt County?
We don't do any sort of, there's no religion involved with the program. There are entities or churches that have adopted the program and they, make it what they will, but there's no sort of religious portion.
Great. Hopefully that answered your question, Anna. Thank you for that. Are there any other questions? If not, thank you all very much to both Lassen and Humboldt County teams. I did put a comment in the chat that the PowerPoints are available under your resources tab at the bottom of your Zoom window there. If you click on resources, there's another tab for documents. You can get copies of the PowerPoint presentations there. And I think that ends our presentation. So if we can all go back to the main lobby and join the main session for the remainder of the day for the closing part. Thank you, everybody. These are fantastic presentations. I appreciate your time and effort in this.